Good evening. We are live at 7 o'clock. I'm Stone Grissom, and welcome to our live coronavirus pandemic special report. Tonight, we have a doctor from NYU Winthrop to help you sort through what's going on with COVID-19 in our communities and across the region. Of course, as always, as every night, this is a call-in show. We want to hear from you. Call us at the number 516-393-1800. All right, let's get right to the numbers right now, because the numbers of positive coronavirus cases here in the U.S., that is now top. Look at the numbers right there. 100,000 in the U.S. New York, the epicenter of the nation's outbreak. More than 44,000 people sick. More than 4,600 of those in Nassau. About 3,400 in Suffolk. The governor wants 4,000 more temporary hospital beds across New York City. And a state lawmaker says health officials should consider reopening the Long Beach Medical Center, which was damaged by Superstorm Sandy. Now, the governor also ordered schools across the state remain closed for at least another 2 weeks. And to help boost this struggling economy, the president signed that massive $2 trillion relief packages, actually $2.2 trillion. That aid is set to put money in your wallets, many of yours, and help businesses. The president is also requiring now General Motors to produce ventilators under the Defense Production Act. All right, let's get right to our discussion. Joining us tonight is Dr. Asif Noor, a pediatric infectious disease specialist at NYU Winthrop. Thank you so much for taking the time during this busy time. So you guys are the true heroes. So let me just start off again. Thank you for everything that you're doing for us in the community right now. You are, oh yeah, thank you. You are a pediatric infectious disease specialist. I know we have now had really our youngest case, 3-week-old baby. I know you can't talk about it because of HIPAA, the specific in cases, but are we now going to see children, much younger children, contracting COVID-19?
Yes, Stone, as we see an increase in the cases in New York, we know that this virus, for some reason, is affecting the adults and elderly. But remember, from China and Italy, we know that about 2% of the cases were in children. So that's what we are seeing here too. In our hospital, about 2% cases are in children. Thankfully, they are mild cases, and I'm glad, that they are self-limiting. These kids are recovering. But as the cases continue to surge in the upcoming weeks, we do expect that the number of cases in young children will also increase. There will be teenagers, there will be young adults, and there will be young children who will get very sick and in the ICU. Having said, most of the cases in children so far are mild.
Okay, so the cases may be mild, and I know in the instances where they do not require oxygen or staying in the hospital, they're sent home. Doesn't that add a complication? Because even though those cases in the children may be mild, they're risking infecting seniors and adults, right?
Yes, absolutely. That's one of the things. Children, are they serving as a server for spreading this infection? Are they the nidus for spreading this infection? When the children, they present to the pediatric office or they come to the hospital, if they don't require immediate intervention such as oxygen, they are sent home indeed. That's true. But we do instruct them when they go back home to make sure we adhere with very common sense infection control precautions. Like children, we encourage parents to teach the children how to wash their hands, just to make sure if they are sick, separate them from the vulnerable. And vulnerable for this virus, we know all the elderly and people who are immunocompromised. So yes, children might be able to spread because they have mild symptoms. Mm-hmm. And indeed, maybe they might be asymptomatic and they would be spreading. But the good thing is because of the mild symptoms, we can send them home. And if they stay home, then the infection, it's not going to spread further.
Okay. Let's go straight to the phones right now. We have Sal from East Meadow. Sal, you there?
Yes, I'm here.
Okay, what's your question tonight?
Okay, my question is, you hear a lot about, washing your hands with hot water and washing your clothes when you come in with hot water and everything. And I was just saying that, does this virus have anything to do? In other words, if this epidemic was during the summertime, would there be any difference in the cases? Because I heard the virus does not like the sun.
Doctor, do we know enough about that yet?
Yes. So yeah, for your question, so um, uh, actually we don't have an evidence. We don't know for sure if this virus does not like the sun. Yes, if we look at the countries affected, if we look at the weather, it's thriving in the winter weather. It's sparing regions which are hot. But I can give you the example of Australia. The weather was hot. We're still seeing surge. It's actually very early for us to say if the weather changes, if it becomes warmer, if it's going to just die down, if this epidemic is going to be put to a halt. It's going to slow down, yes, maybe with the warmer weather, but it's not going to come to an end right away.
Okay. So, Doctor, is this something that we should just prepare ourselves for being recurring seasonal type things, that once we have a vaccine that we're going to be getting a COVID-19 shot every year?
Yes, Stone, I think for now, our job is to make sure that we really decrease the duration of this epidemic here in US. Yes, there is a chance that if this epidemic does linger a couple of more months, and then we are going to have winter in October, the temperatures are going to drop. We have other seasonal viruses that thrive, like flu, like childhood viruses, RSV. When those viruses, their activity increases, there is a chance that this virus is going to come back again with revengeance. So yes, I think we have to bear in mind that it might be that this is the end, but there is a good chance that this will become a seasonal issue. Okay. And that's why a vaccine is needed.
Okay. So I just want to tell our viewers too that we're all social distancing here, so we apologize if there's any hiccups in the connections that are going on, because we're all in different remote locations. It's the new reality that we're all going to get through with together. So let's go back to the phones. Melissa from Mastic. Melissa, you there?
Hi.
Hi. How are you?
My question. Good, thank you. It's kind of similar question. If we can expect to see more of these kind of viruses, possibly with global warming, since the virus lasts 12 to 18 hours on surfaces, is it possible if it was colder, it could have killed the virus? It wouldn't have lasted as long on surfaces? And is it a wake-up call? Maybe we should be focusing on that in the future?
Yes, thank you for your question. I think there are different factors which led to spread of this virus. And absolutely, I think global warming is not good for we as humans and for our Mother Nature, for Earth. Can global warming play a role in spread of this virus? Absolutely. So I think this is a wake-up call for all of us, that we should all be taking care of Mother Nature. We should all be conserving the resources. I think it can play an absolute role, and we should try to focus more on trying to have a good environment, so that at least we can decrease the spread of this virus. Yes.
Yeah, and we're also so globally interconnected now that a virus can spread across the planet in 15 hours. We used to not be able to do that. Back on the phone lines, Teresa from Wantagh. Teresa?
Hi. Yes, I have a question regarding people who are symptomatic. Do nebulizers help with that? Because I understand it's an inflammation in the lungs. Doctor? So would nebulizer help that?
Yes, so the people who are symptomatic, and so nebulizers, most of the word when we use nebulizer, it contains a medication called albuterol. That medication is for asthma. So far we know if people have underlying asthma and they get this virus, it will benefit them. It will allow them to breathe better. But does this nebulizer have any activity, or is it a medication for this virus? No. Unfortunately, there's no good medication right now which we can use for this virus.
Okay. Giovanna from Seaford, you there? Giovanna?
As a patient, how long it takes for results to come in, and when I say that, I mean how long is the longest it's taken?
For test results, are you talking about?
Correct.
Doctor, how long do you, from the time you test it to the time you get the results back?
Yes, again, it depends upon the state because state is overwhelmed right now. It can take maybe 3 to 4 days, maybe like 5 to 6 days. Unfortunately, it's backlogged. There are a lot of hospitalized patients who are sick. We are waiting for their testing. So if you are home, most likely your test went to the state, and they are overwhelmed. So yes, expect about 4 to 5 days at least.
Okay. Let me ask you this, doctor, because it is a respiratory illness or virus. If you're a smoker or if you vape, that will put you in a condition that is more compromised for this?
Yes, absolutely, Stone. Um, I think vaping and smoking already injures your lungs. So if this virus affects an injured lung, it's going to be very hard for the lungs to recover. And again, it actually puts the physicians who are taking care of these cases in a dilemma. Vaping can produce on an X-ray a very similar picture, which might look like coronavirus. But how you treat the vaping-associated injury usually is treated with steroids. But those steroids are contraindicated in coronavirus infection. So it might put a doctor in a very tough situation of what to treat.
Oh, right. It might complicate things. Doctor, we're going to take a real quick break and get more of the phone calls. I know that David from Mastic is on the line right now. Stay on the line. We're going to get more from that. And I also want to ask you about, I know you're being proactive with your ER protocols. I want to ask you what you're doing right now and the work that you're doing to help the other physicians attack this virus. We're going to have much more expert advice on how to keep you and your family safe from the coronavirus. And remember, we want to hear from you. Call us with your questions. Number right there at the bottom of your screen, 516-393-1800. We'll be right back. Welcome back to our live coronavirus pandemic special report. Remember, we want to hear from you. Call us, the number right there on the screen, 516-393-1800. Let's bring the doctor back in. Dr. Asif Noor, a pediatric infectious disease specialist with NYU Winthrop. Again, thank you for your time. Before we get back to the phone calls, I know that you're being proactive, helping develop ER protocols, dealing with young people. Tell us what some of the work that you're doing.
Yes, Stones. So I think I can go back and tell you, we kind of anticipated this outbreak from when it started in China, Europe. So we actually started planning well in advance, late February, early March. We wanted to have a pretty well organized treatment and management plans for children coming through the emergency department. And we wanted to have very clear guidelines for physicians to treat children who might get sick or very sick with this virus in our hospital and in our ICUs. So with this, it's becoming a reality right now. We are implementing these plans. We are trying our best, but still everything is changing minute by minute, not by hours. Policies, we have different issues, we have different difficulties, and our hospitals are actually swamped, and we have to makeshift all the floors. So yeah, so that's kind of the work in terms of planning and educating our physicians, which I'm doing right now.
Oh, well, good luck and thank you for doing that. We definitely need that right now. Back to the phone lines. David from Mastic. David?
Hello?
Hello, what's your question tonight?
Yes, my question is there any record of tests being false negatives? And also, in your opinion, do you think this pandemic is going to result in martial law?
Well, doctor, can you answer those?
Yes, two questions for your first part. This test, it's a PCR. We call it a PCR. It detects the DNA, so it picks up the virus itself. So we know that it's pretty sensitive. It will pick up about 80% of the cases, but unfortunately, it's not a perfect test. We still miss about 20% of the cases. So if we advise if someone really has symptoms which are compatible with COVID-19, that fevers, respiratory symptoms, and someone really has an exposure, we do repeat the test. For your second part, if I understood your question right, you're asking about my opinion for a martial law. Is that correct?
That was his question.
Yeah. If right now with this virus, if as a society, if as a community, as New Yorkers, we do our part, and every aspect of our community, our children, our teenagers, young adults, and elderly, if we really stay home, if we really limit physical contact with others, if we really adhere with physical distancing, then most likely, I hope, that this outbreak will start slowing down. We still have to see the peak, and then we can predict that in mid-April to late April, we'll still see the numbers climb, and after that, the numbers should gradually come down. So if, as a community, we put effort in social and distancing, physical distancing, I'm very optimistic that we would not need martial law. But having said that, it's a virus. We can't communicate with this virus. It's very hard to predict if the way the cases are exponentially increasing, if it keeps on increasing, if we don't adhere, if honestly we don't obey social distancing rules, then yes, there might be a situation which we can create where we might need some help.
Okay. Let's go to Anthony from Hampton Bays. Anthony?
Hi. Doctor, I know that you need an N95 type of mask to prevent you from getting it, the filtration needed. But if every single person, and I mean every single person, wore even a piece of cloth or a different type of mask on their face, wouldn't that prevent the transmission from sick people? I know we can't test the whole population, but if every single person put some kind of mask or cloth or multiple layers of cloth in front of their nose and mouth, wouldn't the aerosol distance be drastically reduced and reduce the transmission?
Okay, doctor, should we all be wearing masks?
Yes. So the N95, as you said, it filters about 95% of the particles. For this coronavirus, we know that it's spread through droplets. So the regular mask that we have, the surgical mask, if we wear that mask, we can prevent the spread. So this mask has two roles. Right now, we have limited supply. So it should be reserved for the healthcare workers. Why? Because they are taking care of the sick patients. They are taking care of the patients unknown coming with fever and cough through the emergency room, through the offices. If they get sick, we don't have enough supply by mid-April, then it's who's going to take care of them. So for your question about if everyone wears the mask, yes, I think if theoretically speaking, if everyone makes a mask, a homemade mask and wears it, it will, if someone is sick, if someone is having coughing, it might help for droplets to spread, but you still need to wash your hands because when you touch your mask, you can still get the droplets on your hand.
Okay, I'm gonna have to stop you right there. I'm sorry about that. We're running right out of time. You're watching our coronavirus pandemic special report. We'll be right back.